Oh, hello! This almost fell on me. What's up? Welcome to Dr. Alexandra Talay's video. This is my patient, Samantha Numchucks. And so we're gonna start with learn meet sign. So
You have to state certain things. This is.
Oh, right. Cool. So, right now I'm gonna do tests that are gonna demonstrate ones for the spinal cord and meninges. Cool. So, Lermite sign was in here. Right. Lermite sign was I'm gonna have the patient bring her. Can you bring your chin to your chest? Okay. Any pain with that?
Nope.
So if they felt shock-like radiations down their spine or out to their extremities, this would indicate meningeal irritation, a severe spinal cord injury, or meningitis. Inflammation or degeneration. Okay. Next is kerning. So, can you lay on your back for me?
Sure can.
So I'm going to raise your leg. Any pain here?
Nope.
Okay, I'm going to extend it or to the point of pain. Any pain with this?
Nope.
Okay. So if I have inability to extend the leg or pain would indicate meningitis and Brudzinski. So I am going to bring your neck up and bring your chin to your chest. Okay. So here, if there was involuntary knee flexion, just like she's demonstrating, that would indicate meningitis as well, or a nerve root lesion. Maybe not meningitis, but meningeal irritation and a nerve root lesion. Great. Okay. Sit up, old shot. So now we're gonna do, I'm gonna demonstrate tests to test the cervical spine. So Soto Hall. Well, let's do Valsalva since she's up. So let's take a deep breath in and hold our breath in and bend forward, and we're gonna bear down like we're making a dookie. And you can relax. So, if you felt pain radiating from the site of lesion, that would indicate a nerve root entrapment by a disc lesion. Yep. So now can you lay down on your back again? We're going to do Soto Hall. So can you take your hands and spread your breast tissue away? I'm just going to press in between them and bring your chin to my fingers. Good. Any pain with that? Nope. Okay. So if she felt pain in the cervical spine, which could possibly radiate down to T2, this is just a general test for the structural integrity of the cervical spine. All right. Now we're going to do tests that are going to test the, we're going to test foraminal encroachment in the neck. So I'm going to do tests for that. So first, let's do foraminal compression test. So here I'm going to have you sit up nice and tall. And I'm just going to be pressing down on your head, okay?
Okay.
Any pain?
No.
Okay, turn your head as much to the right as you possibly can. I'm going to do it again. Okay, any pain with that?
No.
Okay, other side now, as much to the left. Good. Any pain with that?
No.
Okay, so if she felt localized cervical pain, then that would be a foraminal encroachment or facet pathology without a nerve root compression. But if she felt radiating cervical pain, then that would be a foraminal encroachment or facet pathology with a nerve root compression. Let's do maximal cervical compression. All right. So I'm gonna have you follow my thumb with your eyes as well as your head, okay? Good. And other side. Good, good. So, as she was bringing her head back, if she felt pain on that concave side, then that would be foraminal encroachment, either with or without a nerve root compression. Great. Jackson compression. Okay. So now, I'm going to have you bring this right ear to this shoulder, and I'm going to press down, okay? Any pain with that?
No.
Okay, and then opposite ear. Good job. Any pain with that?
No.
Okay. If you felt localized cervical pain, that would be foraminal encroachment facet pathology without nerve root compression. But if you felt radiating cervical pain, that would be facet pathology. Sorry. Foraminal encroachment facet pathology with a nerve root compression. Cervical distraction test. So here, I'm going to have you sit up nice and tall again. I'm going to be like doing a lifting motion on your head, okay? Okay, for real though. If you felt a decrease in localized cervical pain, that would indicate foraminal, that would indicate foraminal encroachment without a nerve root compression. If you felt a decrease in radiating cervical pain, that would be foraminal encroachment with a nerve root compression. Or if you felt an increase in cervical pain, then that would be a muscle strain, a muscle spasm, ligamentous sprain, or facet capsulitis. And this one. So we're going to do Bacodi sign. So Bacodi sign, the patient, say she came in and this side of her body was hurting, or of her neck, maybe radiating, whatever. I would say, okay, can you take that affected side? Can you take the arm, place it on top of your head? I would ask her, do you still feel pain?
No.
They would tell me that their pain decreased, or there was even an absence of radiating pain. This, to me, would be a positive for, it would indicate foraminal encroachment by a nerve root. Nerve root entrapment. Okay, on to the next one.
No.
So now we're gonna do, I'm gonna do some tests for the thoracic outlet syndrome. Eden is not here. Okay, well, you did have to be some memory. So let's start, oh, it's right there. Good. Let's start with Addison. Good. So, I'm gonna have you sit nice tall. You're gonna place your arms completely at your side. Yep. I'm gonna find your radial pulse. Okay. So, I'm gonna bring your arm out slightly. And I want you to take a deep breath in and bring your chin to your chest. And I want you to not do that, and I want you to turn your head towards me and lift your chin up slightly. Good. Good. So, did you feel any pain with that?
No.
If they felt pain or paresthesia, or there was a decrease in pulse rate or pallor of her skin color, then that could indicate compression of the neurovascular bundle due to entrapment by anterior scalene or a cervical rib. Next, Von Eden, costoclavicular maneuver. So here, I'm going to do the same thing. Arm's going to be at the side. I'm going to find radial pulse. I'm going to bring the arm out into complete abduction. Just thinking of a different test. So we're gonna have our arms at our side, and I'm gonna find the radial pulse, and I want you to take a deep breath in, hold it, bring your shoulders back, sit up erect, chin to chest. Good. Release. Any pain with that? Once again, if they felt pain, paresthesia, if I felt a decrease in the heart rate or pallor, that would indicate compression of the neurovascular bundle due to entrapment by the clavicle or the first rib. Good. And then the last one, this one. Okay. Right test, or the hyperabduction maneuver. This is the one I thought I was doing before.
Clearly, yeah.
So, arms at side. I'm going to find radial pulse, do complete abduction. Any pain? Okay. Pain, paresthesia, decrease in heart rate, or pallor would indicate compression of the axillary artery, which would be due to pectoralis minor or the yes, not zeochromium. Corticoid process. Good. Okay. Now we're gonna test the ulnar nerve. Great. So Tanel elbow sign. This is my reflex hammer. It feels like this. Okay. So I'm going to Tanel elbow sign. I'm going to take this, and I'm just going to do that same thing on your ulnar nerve. Any pain with that?
Nope.
If they felt pain at the site or radiating to the ulnar distribution area, that would indicate neuroma of the ulnar nerve. From it, paper sign. So let's take one of these. I'm gonna have you hold between index and thumb. Have your thumb nice and flat, like so. And so I'm gonna try to pull. I want you to hold it. Good job. So a positive would be if I saw the thumb flex like this. It's kind of difficult to see. But if her thumb flexed up, then I would know. This would indicate ulnar paralysis, because the muscle innervated by that nerve would not be working, which was adductor pollicis. is the next one.
Quickly.
So the next one is, now we're going to test the median nerve entrapment. So test for that now. Phelan test. So take your hands back to back like little fishies, and we're going to hold this for 30 seconds. 27, 28, 29, 30. Good, good, good. If she felt pain or paresthesia to the median nerve distribution area, this would be median neuritis. Opposite, let's pray. Hold this for 30 seconds, 27, 28, 29, 30, same thing. You can relax. Pain or paresthesia to median nerve distribution area would indicate median neuritis. And to now wrist sign. So once again, I'm going to take my nice handy dandy hammer, felt like that, and I'm going to... Good. Okay. Any pain?
Nope.
Good. Pain or paresthesia to the median nerve distribution area would indicate median neuritis. Cool, now we're going to do tests for the thoracic spine. So, here's their arm. Okay. So, now we're going to do Adam's sign. Great. Okay. Can you stand up for me and face that way? Good. So I'm going to be looking for scoliosis. Okay. Found it. Can you take your hands, place them together, bend down, touch your toes? Good. I'm looking for a change in that scoliosis. You can come up. If the scoliosis seemed to straighten out, then this would be a negative for the test, indicating that it was a functional scoliosis, there was some sort of trauma, or there was subluxation. But if the scoliosis didn't straighten out, then that would be a positive, indicating structural scoliosis. The next one is beaver. Right, beaver belly button. So, good. I'm going to have you cross your arms, and you're going to try to attempt to do a sit-up for, oh wait, can I lift your shirt?
Mm-hmm.
Great. Good. Come and do a sit-up. Oh, good. So, I'm looking for a superior or inferior deviation of the umbilicus. If I were to see an inferior deviation, if I were to see a superior deviation, then that would mean that there was a spinal cord lesion around T11, T12, or lower abdominal weakness. But if the umbilicus deviated inferiorly, then that would indicate a spinal cord lesion for T7 to T10. Good. And then, Sheppelman sign. Sheppelman shuffle. Come on up for me. So, we're going to place our hands all the way on our head, and we're going to bend to the right, and bend to the left, and bend to the right. So, if she felt pain on the concave side, then that would indicate things. So, if there was pain on that concave side, that would indicate intercostal neuritis. Versus if she felt pain on the convex side, that would be inflammation of the fibrous pleura. Fibrous inflammation of the pleura. Just want to make sure I got everything. Okay, good. Yeah, bye.
Have a good
Oh.